Now, if we've done our consult well, we've explained chiropractic well, nice careful exam in front of the mirror, marking down the vertebra, we got to fix that, don't we? A great x-ray set immediately to Insta report. How do we know this is you? Where does something not look right? Okay. And we go through that Insta report scripting, and then we have the segue into, well, let me do a little bit to get you started. Let me show you how chiropractic works here. Let me do some demonstrations for you. They start to go through the loop. They come in and you start to do some of your chiropractic work, even though, as you know, we don't say we're adjusting them. We don't want them to have the false expectation. And then what's going to happen here is then they're going to come back and we're going to have the report. We're going to draw the diagram. We're going to do the care plan sheet, and they'll commit to care. Now notice, nowhere in here did you ever say something like 4 times a week for 2 weeks and 3 times a week for 4 weeks, because that is all just stupid talk. How that ever happened in chiropractic is it's just stupid talk. It's like I have a crystal ball and I magically know how many visits you're going to need a month from now. If you say 3 times a week for 4 weeks, I'm already looking ahead at when I'm going to be gone and thinking of reasons to not start care. You never say stuff like that. Yeah, but I know it's on your care plan sheet. It's on there just so I don't have a sheet that's only got that much writing in it and a blank page. It's just on there to fill space. Remember now, you have 24 visits, okay? And if you do everything right, every single patient will say this: how often do I need to come in? And that's what you want. You want them to ask you, how often do I need to come in? You want them to tell you, oh, I don't know, I'd come in every week. You want them to say to you, okay, sure, that sounds great. When you say, well, if you'd like, I'll be happy to put, let's do this and da-da-da, and if you'd like, I'll be happy to put together a plan on how to get better. Yeah, that sounds great. You got them to ask you to do the report. You got them to ask you how often they need to come in. You got them to tell you how often they want to keep coming in, versus you telling them they need this and then telling them to do that and telling them why they should keep coming in. See the difference here? The Winner's Edge processes and systems are so smart because we're so smooth, we get them to tell us so we don't have to try to tell them what to do. Okay? So, as we have the care plan and we go through this and all of that, okay, and they're getting relief, they're going to say, because they're walking up front, they know it's 24, they've been there a time or two, so they have to ask, how often do I need to come in? When do you want to see me again? And here is your answer. You want to be here every day of the week you can. That's it. You want to be here every day in the week that you can. Well, I can make it like 3 times in the week. Great. Well, I could be here every day. Great. Well, I can be here twice in the week. Great. Well, I'm only in this part of the city once a week. Great. Every single response is great. Now, if they say, well, I'm only here like 1 time in the week, it's great, but I will let you know. Normally, the faster we can get the adjustments into the body, the better it will be. It's like stitches, okay? If you just got 1 stitch every day, that's not like getting a stitch, okay, every minute and getting it done right away, you see. So we have to be perfectly honest with the anatomy, physiology, biology of the case, the clinical excellence required, okay? But if they can be there twice, 3, 4, it's going to be okay, okay? 4 is better than 3, and 3 is okay, 4 isn't that much better than 3. 3 is a lot better than 2, and 2 is a lot better than 1, okay? There's like a diminishing return, okay, of more visits, okay? All right? So you want to do everything right, so they ask you, and then you simply say, be here every day in the week you can. The sooner we can get the 24 adjustments into your spine, the better. That's what it is. Yeah, but Tory, what if they burn through the 24 visits, okay, before their 3 payments are done? Well, no problem. There's a procedure for that. You simply take the balance that they owe, you add it to a block of 12 on the wellness plan to equal a new amount that they owe. And then you divide that out for 12 payments. Okay? That's all it is. Now, if that's done well and they're in pretty good shape, what they owe plus the payments for a block of 12, okay, when you add it all up and they have a new payment, hopefully the payment is lower than what it was for their initial plan. So they will feel like they get to still come in and they're paying less. It's quite genius. Okay, that's the I burnt through my visits before my payments were done procedure. And what we're talking about here is the how do we make the recommendation for frequency procedure? Well, we want them to ask us. But it's also just very, very simple, even if they don't. Just be here every day in the week you can. The sooner we can get the adjustments into your system, the sooner we can get the response we're looking for you to be better. That's all it is. See how simple it is? It's so easy, and it's true, and you know it's true. And by the way, it's what they're going to do anyway. If you say 3 times, they're going to do what they can do anyway. So that's all stupid talk. You see that? There's so much in chiropractic that's just, did anybody ever look at that and see if that was smart or not? And the answer is a lot of it's not. So in Winner's Edge, we got rid of all of that, and we only have what's simple and smart and real and accurate and clear, okay, and understandable from the patient's perspective, and what's going to be clinically excellent, okay? So there we are. Boom. And of course, if they burn through them sooner, you have your ongoing, I burnt through my visits sooner than I should have procedure, okay? And that can happen with wellness plans also, if you allow it. In other words, with wellness, if someone's got a block of 24 and all of a sudden they start coming in a lot more because something got hurt, really with a wellness plan, they have the wellness plan. And if anything happens where they need to come in outside that, okay, and they're making payments, so they're basically paying for 2 a month, well, if they get any more than 2 that month, they need to pay for those right then. Now, if they prepaid for 24, well, they can burn through 24 as fast as they want. But if they're making payments and they're on a couple times a month or every other week, and something happens and they come in, you have to stop and say, now, Bill, you're on a wellness plan for an adjustment every other week. This is outside of that. This is unique. I recommend we have 3 visits to get you back on track. We will handle those separately. That'll be $150 up front, and then you can just continue with your wellness. But if you just let them do whatever, they'll start to burn through them, and it'll be a mess, and they'll know they're getting more visits than what they paid for. The integrity is broken because you were not strict. You did not keep strict accounts on what was going on with their wellness. So look what you have to track. They got a new patient who prepays. Okay, that's pretty easy. A new patient who makes payments. Okay, you got to make sure that's handled right. Then you got someone who into wellness who prepays. Well, that's easy. They can use the visits however they want. Then you got a wellness person who made an automated payment arrangement, and we got to make sure that they're on track and they don't start to get out of kilter. On the other end of the scale is this. Tory, what if someone just hasn't come in for a long time? Do I stop their payments? No, you do not stop their payments unless they tell you to. For all you know, they're gone doing whatever, and they're going to come in and gobble them all up. You don't stop anybody's payments unless they tell you to. It's their responsibility to let you know, not yours to try to read their mind. Okay? So there's a few very valuable points for your practice growth in keeping it real with your patients, keeping it simple, keeping it honest, and keeping the communication in such a way that they always want to be there.